So now, for our final scenario, we have a pediatric burn case. 8-year-old in a house fire. She is burned just about everywhere, only saturating 90% with a hoarse voice. And as you can imagine, with an 8-year-old who's burned just about everywhere, to no surprise, the medics are going to scoop and run with an ETA of 30 seconds. So with that, what size tube for an 8-year-old? Yes, you can do the formula if it's blown up 6 feet high. But other options, the little finger rule. If you were to take your cheat sheet and you find that this little girl is 8-year-old and you dial in 8-year-old, it'll tell you without batteries, without Wi-Fi, that an 8-year-old should go ahead and get a 6.0 tube. And if we were to look at the Broselow tape, again, we measure head to heels, and we see that this little girl is going to be orange. If on Handtevy we wanted to measure head to heels with that tape, we see that she is orange as well. So if you look at the Broselow tape, it says an 8-year-old gets a 6.0 cuffed. Or on Handtevy app or book, it says you get a 6.0 cuffed as well. And remember, whatever tube you've got, you double it. And that's your NG suction Foley. So if you've got a 6, that means 12, 12, 12. And whatever you're intubated with, triple it, or 3 times the size of the tube is where you tape it. So IV is going to be anywhere, any size. However, if you have no choice, you have no choice. Can you start an IV or drill an IO through burn tissue? And the answer is yes. Now, if you have somewhere else, please go somewhere else. But if you have nowhere else, you're kind of stuck. So if you're going to pop in an IV or drill an IO, what do most people freak about? Putting it through a burn is infection. And that's appropriate. But remember, if you don't get a boatload of fluids, what are they going to do? It's called die. And do dead people worry about getting infected? Yeah, not so much, because they're dead. Which means start the IV, drill the IO. If they live, well, you know what? The burn unit can address that 3 days later. Now, how much should an 8-year-old ideally weigh? Couple ways you can figure this out. Number one, if you take your PD wheel and you dial in 8-year-old, it'll tell you 23 to 29 kilos, with 26 big and bolded in the middle. If, after you measured head to heels, you saw this child was orange, you simply look down at orange and it shows you 24 to 28. And when it comes to Handtevy app or book, it'll show you that an 8-year-old has an ideal body weight of 27 kilos. So with that, if we count fingers, count toes, there hopefully should be 20. So if it's 20 per kilo, we do mental math and say 27 times 20 is 540. Other issues, though, is if we have to give some meds to ward off the evil spirits. How many cc's of epi? Well, if this kid weighs 27 kilos, again, just remember, move the decimal point 1 time. So without internet access, without any sort of other guide, you were able to simply move the decimal point. And in 2 seconds, correctly figure out that this kid needs 2.7 cc's of epi. And she's burned just about everywhere. And that's whereas we have that whole rule of 9s thing. And the rule of 9s, you remember from trauma school, means there's 2 kinds of body parts, and it's called big parts and little parts. And little parts get 9, hence the rule of 9s, and bigger parts are bigger, they get twice that, or 18. But when this really comes into play is with little kids. And little kids are those that are under the age of 2. Meaning at first glance, it looks like a little kid. And if it looks like a little kid, remember they have big old head, little body syndrome. And little kids under 2 have those big old bobblehead, big old Charlie Brown heads on top of their little tiny bodies. And with their big old head, they get a much bigger percent for their big old head. Now, what's kind of neat is specifically on eBroselow, and reportedly in the future with Handtevy app as well, they now offer the option, whereas with burns, you can click and it calculates. And it not only calculates the burn percentage for you, but it also calculates your morphine or ketamine dose. And lastly, it calculates the amount of fluids with Parkland that you need to give for your burn resuscitation as well. And when it comes specifically to burns, thousands of years ago, Aristotle summarized it nicely, whereas he taught that the wise person looks not for pleasure, but freedom from pain. Now, as we finish this scenario, when it comes to burns, especially involving children, if you remember nothing else, all you want to remember is best described as dead, dead, dead. Meaning, if a child doesn't have an airway, what are they? Dead. If they don't get a boatload of fluids and not kept warm, they're quickly going to be dead. And if they don't have enough pain meds, guaranteed, what do they wish they were? Dead, dead, dead.